This is a surgical video demonstrating the technique for DMEK. An angled Sinskey hook is used to score the peripheral Descemets membrane for 360 degrees. Trypan blue is then used to stain these edges to aid in visualization. The angled Sinskey hook is then used to free the peripheral Descemets membrane for 360 degrees in a sterile viewing chamber filled with Optisol. A toothless forceps is then used to carefully peel the Descemets membrane off of the peripheral cornea. With care taken not to tear the tissue. The graft is then transferred to the same corneoscleral rim and stained with trypan blue. Attention is turned toward the patient where a temporal incision is created using a 380 micron step blade. An inferior paracentesis wound is then created, as well as nasal and superior paracentesis wounds. A 2.8 keratome is then used to create a short tunnel, and the anterior chamber is entered. Ocucoat is used to maintain the anterior chamber during desmetorexis. A handheld 6 mm inked trephine is used to guide desmetorexis, and here the reverse Sinskey hook is used to score the endothelium for 360 degrees. The Sinskey hook is then used to gently peel off Descemets membrane. Which is removed in its entirety. The INA handpiece is used to evacuate all viscoelastic material from the anterior chamber. The graft is then again stained with trypan blue. And transferred to a star ICL cartridge filled with BSS. Touching the distal tip of the cartridge and dropping BSS in the proximal end of the cartridge allows the graft to move down the shaft of the cartridge. A small amount of Ocucoat is placed at the distal tip to keep the graft from extruding from the cartridge. The cartridge is then loaded onto the injector, and the star ICL injector will then be used to transfer the graft into the anterior chamber. Once the graft has been transferred into the anterior chamber, the temporal incision is closed with 3 interrupted 10-0 nylon sutures with the knots buried. Initial manipulation with BSS on a cannula shows that the graft is curling towards the iris, confirming inappropriate orientation of the graft. With bursts of BSS, the graft is flipped. And here Descemets membrane can be seen scrolling towards the cornea, confirming appropriate orientation. With the appropriate orientation confirmed, a small air bubble is used to maintain the appropriate orientation, and a Sinskey hook is used to make fine modifications to the positioning of the graft. The proximal portion of the graft is unfolded again with the Sinskey hook. And once appropriate positioning has been confirmed, a complete airfill is achieved in the anterior chamber for approximately 10 minutes prior to concluding the case. The patient will then be examined in approximately an hour after the conclusion of the case at the slit lamp.